Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous materials on the subject of my special order.
Without objection.
Thank you, Mr. Speaker. I rise today in support of the Health Exchange Security and Transparency Act, a bill that forces the federal government to notify individuals if their personal information has been stolen or unlawfully accessed through an Obamacare exchange. Since the disastrous rollout of Obamacare on October 1st, we have heard story after story, Mr. Speaker, of security threats and privacy concerns with the troubled Obamacare insurance exchanges. From the Chief Information Officer at CMS claiming that, and I quote, "There is also no confidence that personable identifiable information will be protected," to an administrator at CMS saying that the Obamacare website, and I again quote, "exposed a level of uncertainty that can be deemed as high risk," to a computer security expert calling the Obamacare website a hacker's dream. It is clear that the Obamacare exchanges were never ready to be launched. And it's unconscionable that this administration would expose millions of Americans' personal information to cyber threats and identity theft. To make matters worse, there are laws already implemented that require private companies to notify innocent victims of these security breaches. But President Obama didn't think it was necessary to live by the same rules as the private sector, and decided to push his failed agenda despite senior government officials warning him that his website was not safe for the American people. Every day, Mr. Speaker, I hear from far too many hardworking families in Missouri's 2nd District who have seen their premiums skyrocket, wages decreased, insurance coverage canceled of late, and hours cut back at work. These families are already suffering from the harsh realities of Obamacare. And to make matters worse, they have no idea whether their personal information has been stolen or not. Just recently, Mary Ann Schaefer wrote to me from Kirkwood, Missouri, about how worried she is that her most intimate information could be stolen from the Obamacare exchanges. And I quote from Mary Ann Schaefer of Kirkwood, Missouri, "I am concerned about the security of my sensitive medical records in a big government database." Mary Ann is just one of the many people I hear from in St. Louis region that are worried about the devastating consequences of Obamacare. While the only way to truly protect the American people from Obamacare is by replacing it with free market-based solutions that expand access without destroying our economy, putting the federal government between you and your doctor, and lowering the quality of our care, the federal government, Mr. Speaker, should at the very least be required to report any security breaches on the Obamacare website to those innocent victims who, through no fault of their own, trusted a government that deceived them. Since President Obama decided to delay the implementation of Obamacare for unions and businesses for an entire year, don't you think the least he could do is working Americans if their personal information has been stolen or breached? Mr. Speaker, the simple truth is Obamacare is wrong for the American people. It is wrong for hardworking Missourians, and it is wrong for the people of Missouri's 2nd Congressional District. And it needs to be replaced immediately before any more of its harmful provisions are implemented. I urge my colleagues to vote yes, a resounding yes, on this common sense measure. I would now, Mr. Speaker, like to yield to my good friend, Representative Diane Black, who has not only spent countless hours championing the Health Exchange Security and Transparency Act, but who has tirelessly worked to improve our nation's health care as a small businesswoman and a nurse in Tennessee, and now as a member of Congress. I yield to the gentlelady from Tennessee, Mrs. Diane Black, for as much time as she may consume.